Okay. Today I am going to be performing a shoulder adjustment on Tyree here. Tyree is our patient who's been with us for a little bit here. We're working on his tight, stiff shoulders. So we're going to demonstrate some of what we do here. So check for ranges of motion. Identify the areas that are not working right. And then go into the different movements here. Every once in a while we get a pop or release, sometimes not. And it's not painful, right, Terry? No. Just take your figure eight tight movement there. Some tugs on there. In Tyree's case, he has a lot of tightness with his shoulders as they tend to stiffen up there. As we've been getting more and more motion here between the rehab and the adjustments, we're freeing things up here to get better movement and less discomfort. Excellent. Some movement here again.
Based on my calculation, it'll be like January.
And there we go. That's the shoulder adjustment.